Thank you so much, Jonah, and I want to thank Dr. Smith, my good friend Donna Green, Congressman Town, and Teddy for his innovation and thought around this important issue. And also, I see Willie Scott is on, who really is an example of a success story. And he sent me a photo today of showing a before and after picture of how he has taken his health into his own hands as he becomes the leader of his health team and coordinated with his doctors, his dietitians, and his personal lifestyle change. And I'm happy for him, and I'm sure he feels better about it. The COVID-19 pandemic has revealed the stark disparities in our healthcare system, which have led to unequal outcomes. Black and brown New Yorkers are twice as likely as their white peers to have died from the virus. They are also more likely to be hospitalized by the virus. These numbers are clear, and we hear them not only in New York, but across the entire country. Neighborhoods like East New York have been hit and continue to be hit the hardest. The city's statistics show that the 11239 zip code, which encompasses East New York, has averaged 104 per 100,000 cases in the past 7 days, the fifth highest rate in the 5 boroughs currently. This is something we cannot continue to ignore. While we are still fighting this pandemic, we need to look at the underlying conditions that contribute to the disparities we are seeing now. The numbers tell the story. The rate of avoidable hospitalizations, which are defined as hospitalizations that could be prevented if adults had access to quality primary care, is more than double of the citywide rate among adults in East New York and Starrett City. East New York and Starrett City's adult obesity rate is 35%, 11 points higher than the citywide rate. That's why the numbers don't lie. And if you do a correlation, you will see there's a direct connection between the obesity and some of the pre-existing conditions that we are facing. 14% of the people in this catchment area have diabetes, while 34% have hypertension. These are exactly the same conditions that are leading comorbidities with COVID-19. That's why today we are proud to promote the Rise Up East New York initiative, the initiative led by Dr. Barry Smith from Applied Medical Research Incorporation. We use cutting-edge technology and community-led outreach to residents to reduce rates of chronic disease in the neighborhood. The initiative is partnering with the One Brooklyn Health System, who you will hear from in a moment, to ensure all residents receive the quality of care that they deserve and are educated on how to keep themselves healthy. One of the most exciting innovations they're using is in partnership with pulseData, which uses sophisticated tools for risk stratifications to determine which patients have the highest need for medical care. This is the new direction in healthcare. We can't only be just reactive, but proactive. And by bridging technology and proper lifestyle changes and healthy and good healthcare systems, we can tackle chronic diseases and help those who are experiencing conditions associated with a pandemic. Not only does this make our healthcare system more efficient, it helps hospitals and providers save money. We want to send a message that this exciting initiative is starting right here in Brooklyn, but has the potential to scale up citywide and revolutionize the public health as we know it and can cascade throughout our entire country. Our healthcare system is not sustainable. When you look at 30 million Americans are diabetic, 84 million are pre-diabetic, diabetes being the leading cause of blindness, non-trauma limb amputation, and contributing factor to so many other chronic diseases. We must get diabetes under control and other chronic diseases. As someone who went through my own health journey, I believe it is critical that we tackle the unacceptable high rates of chronic disease in Black and brown communities. And this exciting new initiative is a promising first step. So I want to thank all the partners who are involved. I believe this is the beginning process of addressing the real issues around chronic disease. Not only do we need everyday New Yorkers to get their vaccine shot, we also believe that this is our shot to finally get health care right in our city, in our borough, and in our country. Again, thank you so much for our partners in this initiative, and we look forward to moving this forward.
Thank you, Borough President. Sorry about that. Next, we'd like to hear from Dr. Barry Smith with the Rise Up East New York initiative. Dr. Smith. Dr. Smith, you're muted at the moment.
So, Borough President Adams, Congressman Towns, distinguished colleagues and friends, I think the Borough President has said a tremendous amount. And what we want to do with Rise Up East New York, it's all about changing the statistics that he mentioned. It's making East New York, Brooklyn, a shining example of what the community can do to make health and lives better. That's all this is about. And I think as the Borough President said, the US system of healthcare is badly in need of reform. And COVID-19, as he also said, has highlighted that. The house, we want to call it that, of the healthcare system we have built is upside down and inside out because it's a system that pays for providing care to sick people rather than maintaining wellness. And that's something we have to change. You know, the US, and just to go back a little bit, spends more than any other nation on earth. It's close to 19% of our gross domestic product. And yet we're low on the list of life expectancy. Depends on the list you look at, but somewhere around 53rd out of all the countries. Japan, which spends half as much as we do, is number 2, and their citizens on average live 7 years longer than we do. So we have to make changes, and I believe that Eastern Brooklyn is where we're going to start to make these changes that are so necessary. And they're not just in health, but this is also about quality of life. Now, why in Eastern Brooklyn? Let me say that we're coming to East New York asking for nothing, bringing us experience we've had in 32 countries over the last 30 years. We've got our own funding. We're blessed with that. And we have our office now at 240 Cozine Avenue. So we're really part of New York, and that's our only office. But what are the elements? Strong political leadership that cares about the well-being of people at the local community and borough level. I think that's absolutely essential. Secondly, the One Brooklyn Health System, which you've already heard about, which is now a reality. I think that is the most important experiment in New York City and New York State today. And it's perhaps one of the most important experiments in the country about providing better health care. And what it gives us is the ability to do lifelong health screening and promote wellness and education on a broad scale. And of course, if you get all the data that will imply, we need risk stratification to pick out the people who are at risk. And that Teddy Cha at pulseData will talk about next. Another element that's very important are the large numbers of groups that are doing good work on all kinds of matters of social and health, more directly health interest in the borough. And those are nonprofits, community-based organizations, government agencies, and even some for-profits. So what we're doing is committed to making all of those efforts come together in a more integrated fashion so that the impact will be greater. And finally, the next element, which is perhaps the most important, that's the good people of East New York themselves. If we're going to change the system, it has to be the people who make that change. It can't come from the outside. It can't be legislated. Legislation can help, but it has to be the people themselves. And what I think is important, what the residents of East New York that I'm talking to are saying, we're not going to accept this anymore. We need to change it, and we're willing to fight to do so. We can be the example the country needs to drive change for the better. So when you put all of this together, that's what Rise Up East New York campaign is about. And we have a unique set of elements that I think make it possible. The joint dream is to include East New York among the healthiest, most equitable, longest lived, and best quality of life communities of New York City, and make it a model for improving health and quality of life in New York City, New York State, and I believe in urban areas across the United States. Now, I'll finish with two thoughts. We already know that COVID-19 is reminding us that we have to address the health disparities that exist. And I'd like to make an argument. Instead of talking about the social determinants of health, because the word determinants has a sense of inevitability, I think we should be talking about the social opportunities for change for better health. And we should seize those opportunities, whether it's housing or transportation or whatever it is. And of course, health is a product of everything that works together in the society. Because health is not a thing unto itself. And what comes out of East New York, as I said, I think really can change the quality of life across the United States. Now, America is properly honoring Martin Luther King this weekend with the holiday, and he had many great insights, including his I Have a Dream speech. I'd like to give you another of his thoughts and leave you with that. Human progress is neither automatic nor inevitable. Every step toward the goal of justice, and I would include health and quality of life in that, requires sacrifice, suffering, and struggle, the tireless exertions and passionate concern of dedicated individuals. In honor of his memory, let's do it together. We can accept no excuses. Thank you.
Thank you, Dr. Smith. Next, we would like to hear from Teddy Chaw, who is the co-founder and CEO of pulseData, to hear about how his organization is partnering with Rise Up East New York and some of the work they're doing. Teddy?
Yeah, thank you so much, Eric and Dr. Smith. It was amazing to hear your passion, I think, behind this, because we really need that in partnership with what pulseData does. So for pulseData, we believe that the best healthcare is delivered proactively, before a major failure, before the ambulance ride, and before the ICU. The way we do that, pulseData uses data science to find patterns. We figure out which members of the community are suffering from chronic diseases, which ones are at the highest risk of a bad event, a hospitalization or progression of their disease. And we precisely identify which ones need to be matched to care, and in doing so, we'll avoid a hospitalization or a catastrophic event, and even predict who is going to, for example, have COVID complications. So we have the technology to do this right now. We talk about the state of the art in data science and artificial intelligence, machine learning. Look, Facebook knows what you're going to read next. Amazon knows what you're going to buy next. We can predict who is going to end up in the hospital and who's going to benefit from care. The technology is there. I know this because I've built a whole company that is entire mission is to do just that. Is to take healthcare data, the data that already exists in the system right now, the data that already exists within your hospital, with your care managers, with your doctors, and in community organizations. And with that information, we can pinpoint and tell you who is suffering from chronic disease, who's suffering from multiple chronic diseases, and who will benefit from very timely and precise care. So we have the technology to do this now. So very excited to have spent and dedicated our company to, and the amazing team that we have here to that effort. And in doing so, really start to address not only better care, but also to start solving for many of the disparities in healthcare. One of the reasons why Brooklyn is a particularly exciting place for us to be working in is that the folks that get worse outcomes in their health, these are the ones that are the less likely to seek care early in their disease. These are the ones who are less likely to understand their disease and get the education that's necessary in order to manage it. We need to meet these people where they are before they have a personal catastrophe. And the only way to do that is to use data science, because these folks, the only time you see them in the health system is in the emergency room after they've had this super bad event. And it's kind of like trying to win the game in the last 2-minute drill, when someone's already sick and very expensive and have had the bad event. So we use data science to find these people, discover them before that time, so that care can be matched to them. Now, the only way that works for us is with partnerships. We can do all of our fancy technology and all the data science, but at the end, no machine or bot or fancy algorithm has ever moved someone into care. So the moment of healthcare is still a human connection. It is someone empathetically delivering a piece of care to someone else, an empathetic touch. And so we need to partner. The technology needs deep partnerships with the community organizations, local health systems, patients and families, in order for our work to have any impact at all. And to actually touch and move folks. So that's one of the reasons why this particular partnership is incredibly unique and exciting for us, coordinating with One Brooklyn. And I'm very excited for you to hear from Donna in a moment, partnering with the Dreyfus Institute and the local Brooklyn community that's around. That is the only way that our work actually impacts people and moves them into care. And so very excited to put that together here and make Brooklyn a true blueprint for how this is done in every community around the country.
Thank you very much, Teddy. Appreciate it. Finally, we're going to hear from Donna Green with the One Brooklyn Health System to speak a little bit about their partnership with Rise Up. And then following that, we are going to open it up if there are any questions from the press for anyone who's spoken. So Donna, go ahead. Donna, you're still muted if you want to unmute yourself.
There I go. All right. All right. So good afternoon. Good afternoon, Borough President Adams. Barry, good to see you again. And Teddy, good to actually see you, because we've spoken, but we haven't seen each other yet. So I just, One Brooklyn, for anyone who doesn't know, it is a health system in Central Brooklyn, Central East Brooklyn, and it is comprised of 3 campuses: the campus of Brookdale Hospital Medical Center, Interfaith Medical Center, and Kingsbrook Jewish Medical Center. And those 3 campuses have received capital funding from New York State, significant funding to help us grow our access, grow our ambulatory care network, which would provide greater access to patients, to help us bring some technology in the form of EHR to the systems to pull them together electronically so that they are communicating with each other and taking advantage of resources together, and also to strengthen, modernize, and make more efficient the infrastructure of the 3 campuses. So we are in a very dynamic and exciting period, and so no greater time in many respects than to be involved with Rise Up. So we're right now having conversations to put the clothing on this partnership with Dr. Smith and with Teddy Cha. We're very excited, of course, because you've heard the statistics from Borough President Adams, and we're more than aware of that. We know we have a mission to help people live their healthiest lives in Central Brooklyn, and so in order to do that, this is one area we can tackle. The vision for One Brooklyn with this partnership is to, there's many people have heard of evidence-based work, and Dr. Smith has, he has evidence-based behind the work that he's done, but there is uniqueness to the communities that One Brooklyn serves, and when there's uniqueness, and it's going to be uniqueness in any community, but in our community, the uniqueness here means that there is a way that you reach the residents and the patients in this community in order to engage them so that they will self-manage, that they will participate in their health, and to be able to touch and motivate them in that way. A lot of times that work is not always something that is funded, because it usually takes a high touch, meaning that you're going to not only touch someone by the physician champion that you engage in this, or just by the nurse champion. It's going to be the health coach, of which we have health coaches who are going to be there to inspire and to tell that person who didn't show up, hey, I noticed that you didn't show up. It's that high touch that makes you engaged, and so we're able to, we have, as I said, we have health coaches, may need more, but again, as we're sort of putting the clothing on this endeavor, and as we build those layers, we'll find those layers that make this and make this particularly inspiring for the residents of Central Brooklyn. And when that happens, then we have an evidence base for our population, and an evidence base that we can go out there, on the road, do all of our community, and do similar communities, and apply the interventions, the coordination, the resources that come to it, and to be able to help these residents and our patients make a change for the better in their lives. So as Barry said, there's an opportunity for change and for better health, and it's here. We know it's here. We know our patients will benefit from this collaboration, and I want to, for One Brooklyn, to build that evidence around the patients that we serve. So I'm going to stop there and allow you to keep going on.
Thank you, Donna. Appreciate it. At this time, we're going to open it up to any questions from the press. If there are any, just feel free to unmute yourself. And if there are none, we want to thank folks for joining. And just a couple of housekeeping items. A recording of this Zoom will be uploaded to YouTube so that everyone can view it a little bit later today. And a brief press release will be sent out following this as well. But we want to thank everyone for joining. and have a great rest of your day.